and our HODs who are part of us. I think that will be the introduction, colleagues. And that, President, we thank you that you have taken time to be here. And on the purpose of the meeting is to update and to brief the President in particular on the situation and the manner in which the province is trying to handle the challenge of this pandemic of coronavirus. We will therefore present the report. We'll lead the report because it entails all departments that are involved. I will quickly move to take the meeting through the report. And in the report, we have highlighted a number of issues, but I must indicate that we have two reports. The first one, it's a thick report which details everything. It is here. But the second one is the summary of this thick report. So I'll go through the summary, and in all it has few slides, very few slides because there are 25. So it's not a long report. I'm hoping that someone will be flipping there and so that it is beamed, but I will use the laptop with me here. Firstly, we thank the President for taking time to be with us to understand how are we working. Since the President announced the outbreak of COVID-19 and the establishment of the National Command Council as the province of KwaZulu-Natal, we started coordinating our response, and we established the Provincial Command Council. It is in place, chaired by the Premier. It meets 3 times a week, but it meets once where we come together in this way, and twice we get update report on key issues. We do have a command center, the Provincial Command Center, and that is a technical team which is chaired by the Director General, and it meets twice a week. We also have the JOC, the Prof JOC, which is led by COGTA and the Department of Health. They meet twice a week. We also have the Prof Joint, which is the meeting of all security clusters and all departments. It's a meeting of all security agencies and all departments that are key, and they meet on daily basis. We also established the district command councils in each and every district, and those are chaired by the MEC champions and the district mayors. In our case, MEC champions, each and every one of us here in the Executive Council, we are attached to districts. There are 10 districts plus metro, meaning 11 in all, and the Executive Council has 11 members with the Premier. So each one is in a district, and that is the formula that cascades through Operation Sukuma Sake. So we are working with districts in that way. The province has a provincial plan, and it's finalizing the post-level 5 recovery plan. We are working through clusters, which is the cluster of the social cluster, and we have the economic cluster, ACID. Then we've got the governance and the state institutions cluster, which is GCID. Then we have GCIS, JPS, yes, the Justice and Security Cluster, and then those are 4 clusters that we have. We are driving an integrated communication and awareness campaign. The Provincial Treasury is in the process of conducting a detailed analysis on the COVID-19 on the provincial budget. Just to be specific on the provincial situation, the summary of cases as of the 3rd of May, confirmed patients in KwaZulu-Natal stands at 1,077, with 25 cases that are new. Those in hospitals are 268, new 3, and then recovered 416 have recovered. When it comes to deaths, we've experienced 35 deaths in the province, with 3 deaths being added in the past weeks. When it comes to community screening and testing, the approach of the province to mass screening and testing is by establishing 3 types of teams, and these are the contact tracer team, the community screening and testing teams, and the roadblock teams. The roadblock work with the SAPS in all areas where we are doing roadblocks. The contact teams, so far, they've managed to deal with and monitor contact that are about 3,131, and contact that are not yet traced, they are about 2. The status of those monitored and having completed 14 days is 1,817, and those that are in progress, it's 1,314. Samples collected from contacts, it's 2,505, and samples not collected, it's 626. Positive rate, it's about 133. In terms of the wellness of employees, the provincial government has developed an occupational health and safety guidelines to protect healthcare workers during this time. The personal protective equipment is being provided to relevant healthcare workers based on risk assessment, and also providing PPEs to all employees. In terms of the status of beds, the Department of Health has reorganized and assigned current beds for patients under investigation and isolation beds, which is those who are positive. In addition, the department is renovating and reconfiguring the existing clinical spaces in public facilities and establishing field hospitals in order to increase bed capacity and to meet isolation and quarantine requirements. The province is also accepting offers from the private sector to increase the bed capacity. We must thank that there are those who have donated with one hospital. We know of a private hospital where we were given 96 beds, and that was a donation from the private sector. So there are a number of private sector companies that are making different contributions. Intensified lockdown started on the 20th, and in eThekwini we intensified on the 20th, trying to scale up because of the fact that we've identified that eThekwini was becoming the epicenter in the province. And we identified some areas such as Umlazi, Chatsworth, Verulam, and Westville. We've worked very well with the Metro in dealing with that program, which is still continuing. On the issue of communication and community education, we have a plan which is led by communication, and it is adopted by all of us as the executive. And that plan includes circulation of information through the media, through the social media, But we've also established the online information hub, which is on the online system of the province. Indeed, we use the mass media as well. In terms of beds allocation, so we have a plan of operational beds. The first one is using Pilsika Isaka Seme, and they have a capacity for isolation, which is 1,204, and 937 for quarantine, and ICU for, they've got 40. Durban Exhibition Center, we are establishing, this is a conference facility, we are establishing there. We will have a center, a facility that will have 450 beds for isolation. Claywood Hospital, they have 226 beds, and I must say we have visited Claywood and conducted an inspection in local. Amatigulu Training Center, 113 beds, that is for quarantining. Ngwelezane, it's 113. Royal Show in Pietermaritzburg is 269. Montclair, it's 157. Coastlands is 952. And then Shaka's Rock, we have 118. Then there are private hospitals. The one I referred to, Ascot Park, 87 beds. So in total, we have 2,141 beds that are ready for isolation, and we have 3,479 beds ready for quarantining, 3,479. And for high care, we have 16. Then for ICU, we have 143. When it comes to the intervention in mitigating the impact of the lockdown, we are working through the social relief of distress, and we have outlined the process there, where we start. Step one is to identify households. Step two is to ensure that they are registered with DSD through the use of counselors, war rooms in DSD offices. Then step three, we consolidate the list, screen the list. Step four, then counselors, social workers do assessment together with SASSA. Applications then get approved, then delivery note and the register get consolidated on daily basis. The recipient at household levels get food packs and then sign off. Food distribution agencies, they deliver within 3 to 5 days. I think we have improved so far, because at some point there were complaints, but now I think complaints are being addressed. The level and the pace of providing food relief programs is at a faster level. We have also approved that in some areas we are going to use vouchers that will be sent to people to collect food which are distributed. So I would say the province also have heeded, and it's following the direction that in providing this mitigation, we must strictly respect the dignity of the people we are serving. In most cases, we deliver at home, or even if it is groups, it will be a group of people in the nearest area where they will just collect and go home. With regard to the number of food relief programs, the application received so far is 95,001, the total in the province. And the assessed one is 44,645, and the food parcel issued is 32,276. The pending, which is being processed, is 57,459. But the table there then present applications per district and the progress so far. When it comes to shelters for accommodating homeless people, these shelters have been much needed in eThekwini and Mkungundlovu, which is Pietermaritzburg and surrounding. And so far, the shelters that are in KwaZulu-Natal as a whole are 61, and the one that we identified are 61, but one that are now effectively in operation are 29, and so far people who have been accommodated are 2,125. Of that provincial number, 1,669 is from eThekwini. Without dwelling on this, I must say the problem with provision of shelters for homeless people is that we accommodate them. We will ensure that they get collected and accommodated. They will stay a day or two, then escape. That is the problem. We are trying our best, and we do have a sufficient accommodation in all districts. I will say in other districts we identified, but those facilities have not been used. One case we identified 4 in Umkanyabute, but we have not utilized because there is no one in that area. So it depends on the demand, and areas that are more urban are the one that will need more of these shelters. When it goes to the issue of basic services, starting with water, it has been a priority in almost all of KwaZulu-Natal. We must say water challenge is a challenge now, but it has always been a challenge, the issue of water in the recent years. For short term, we have provided static tanks and water tankers. And I would say water tankers are working together with static tanks. We are also we are working on drilling of boreholes, working with Copter, and we have worked on the MIG, the Municipal Infrastructure Grant, reprioritization of about 502 million to cover that program. Mid-term program is focusing on funding, which is 84 million transferred to municipalities to address hotspots. And that is the areas, those are areas of Uku, Amachuba, Uthukela, Umkanyabute, and Ilembe. Addressing water issues as well as implementing water conservation and demand management is continuing through water service infrastructure grant and the regional bulk infrastructure grant. In terms of the mid-term, new boreholes that are planned will be costing 287 million. Refurbishing 601 boreholes that are already existing is going to cost us 91 million. Spring protection, 51 million. And the regional bulk infrastructure grant is expected to also provide support to Lower Umkomazi project. For water hotspots, we still have challenge in Uku, Ilembe, Umkanyabute, Zululand, Herigwala, and Uthukela. But all of these are unfunded, and therefore there will be a need to ensure that there is more funding for water in KwaZulu-Natal. Waste removal as part of the intervention, the focus is on 4 areas to improve hygiene during this time. The first is waste cleaning, waste picking, clearing of illegal dumping site, that is continuing. The second is dislodging, which is taking place all over KwaZulu-Natal. The third is clearing of sewer blockages and sewer spills, which is taking place. Then it is sanitization of public areas. Targeted areas here are those with high density and congested townships, areas with high traffic volume, illegal dumping sites, informal settlements, taxi and bus ranks, dilapidated and secluded town areas, areas where municipalities are not collecting waste regularly, and areas surrounding sewer spillages. So that's the focus. The provincial sanitization program was launched at Inyoni informal settlement in Ilembe district under Mandeni municipality on the 21st of April. In the first phase on the program, the rollout was ending on the 30th of April and focusing in 10 districts and 9 municipalities and 18 informal settlements covering 15,000 households were serviced during that time. The program is continuing, and the second phase of this program will target eThekwini, among others, and the priority areas have been identified, and these will include provision of ablution facilities, static tanks, standpipes in various informal settlements such as Caton Crest and Kennedy Road. On interim relief for cultural and creative industry, as well as sports and recreation. So the sector have also been very affected, with a lot of them engaging us for the assistance. And through the Department of Arts and Culture, the interim relief for cultural and creative industry was adopted by the Executive Council. We have also developed an action plan for this social relief. We developed also the provincial criteria in line with the national criteria. So taking a cue from what the national, through the Department of Arts, of Sports, Arts and Culture, that is what also we are doing in the province to assist our artists and athletes. And therefore, we are looking forward to, we are going to be providing this relief to athletes, coaches, technical personnel, sports fraternity, and various entities within the recreation industry. Within this plan, we've developed an implementation plan with specific criteria to ensure that almost all of them are assisted. When it comes to the economy, we will indicate, we want to emphasize, President, that in terms of economic response, the province has been affected seriously, but through the Provincial Command Council, we discussed, and through the departments that are involved, we've taken the following interventions. The provincial SEZ, in particular the Dube Trade Port and the Richards Bay Industrial Development Zone, waived the payment of the rent by their tenants who are affected for 3 months. It's not that we are saying they will not pay, but it's a holiday. For that, then they will, when they pick up, they will have to pay. We are also focusing on ensuring that our provincial development finance institution, which is Itala Development Finance Corporation and KwaZulu-Natal Growth Fund, we have approved the 6-month payment holiday without penalty or interest accrual to those clients. Various provincial funds have been developed, such as the Trade and Investment Business Support Fund, KwaZulu-Natal Tourism Fund. They have also avail resources to complement and support the intervention on businesses that are going through distress. One-stop shop, which was launched some years ago, the provincial one-stop shop, is assisting businesses with applications. There are those applications that are provincial, but there are applications that goes to national. Within the one-stop shop also, we've developed an electronic app to log in queries, and we are assisting people through that app. On top of that, there is also a call center that is assisting. KZN Growth Coalition, which is the collaboration of government of the province and the business sector as well as labor, is playing a significant role in providing financial and non-financial support. And some of these are interventions that are just directed to communities. We have also an industry of agriculture, which is one of the sectors that are facing challenges, and the province issued permits to officials across the province to ensure that the provision of extension and advisory services to farmers continue even during the lockdown. On top of that, we supply seeds and fertilizer, but also an online database for farmers was created to ensure that they are given support packages. We have a program which is called Radical Agrarian Socio-Economic Transformation. In short, we call it RASET. It is supporting small-scale farmers. We are providing them transport logistics, subsidized packaging material, and ensure that there is a market. We have provided 5 districts with 17 trucks and 10 buckies, which happened a long time ago, but it is more effective now. Approximately 1 million paid to 206 previously disadvantaged individuals, and this support is ongoing. We can safely say that through the intervention, we have ensured that even these small-scale farmers do get market and they are supplying on weekly basis. Enterprise support, we've deployed district officials to support SMMEs throughout KwaZulu-Natal, continuous dissemination of information on the national relief funds and schemes to small enterprises. We attend to queries on a daily basis, and we provide feedback to all of those enterprises, small enterprises. The database of informal traders and number of permits, especially for informal economy and spazas, have been created, and to date, 16,234 have since been registered on this platform. So for the program that aims to support small-scale enterprises, we have a database that is complete. As the provincial government, we are also finalizing the provision of support to informal economic traders and spazas through subsidy and bulk buying support. The bulk buying support is one of the interventions to assist traders and spazas. When it comes to business inspection and consumer complaint attendance, as the province, we have ramped up the business inspection across KwaZulu-Natal to enforce compliance, especially with lockdown regulations. 4,661 consumer complaints were received between the 27th of March to the 24th of April, and these complaints received were sent through our WhatsApp platform, telephone calls, and some are written. And we are attending to all of these, assisting them. The high number of complaints relate to excessive pricing related to meat, rice, potatoes, sanitizers, and face masks. So there are clearly people who have taken a decision that while the country is engulfed by this pandemic, they will want to maximize the benefit. And that is what we're clamping on and dealing with as the province. Total number of complaints received between 18th of April and the 24th is 394. I'm not going to get into details. All of those are there. There are cases, there are those who have been fined, there are those who have been arrested and are going through the process right now of being prosecuted. Law enforcement is one of the area under JCPS. The joint law enforcement operations are taking place. Law enforcement personnel deployed are on the average of 10,000 per day. Number of roadblocks that have been held since inception, 2,712. Vehicles stopped, 226,848. Cases opened, 16,917. And there have been arrests of 18,318. And there are a number of how those cases were conducted there. There are those which have been completed. People have been fined, and the convictions are at a level of 239 as of March 30. Criminal incidents at schools. We've seen a new challenge. There has been an eruption of a challenge where there have been vandalization, theft, burglary, and arsons in schools. And 225 schools were affected, with 3 schools set alight, arson in 3 schools. And I think that has affected the Department of Education seriously. 9 suspects have been arrested. Police oversight, the monitoring of police stations is continuing, and I think preventative measures and enforcement of regulations goes well. One challenge we're facing is the gender-based violence, which is on the increase. Police have opened 449 cases of gender-based violence. 10 cases reported through the National Gender-Based Violence Command Center, and we have listed the cases there. A total of 15 cases reported through the Center of the Department of Social Development. A total of 82 women and 3 men have been admitted to specific shelters by DSD because of this problem of gender-based violence. Psychosocial services rendered. So far, a total number of 7,247 persons have been reached through psychosocial support services by DSD. When it comes to the post-lockdown recovery, but the post-level 5 recovery, our response has been characterized by a number of issues. But firstly, we take a note that we are also facing a serious challenge in terms of the economy with the 2 downgrades, one of the Moody and another one of the Fitch. The capacity of the state to deal with current, medium, and long-term issues, the economic support that is needed to ensure that we protect the people who are going to be affected by this. Then, lastly, the impact of COVID-19 to the education sector, especially the teachers and learners. So on a long term, we start on a long term, which was a year to 2 years, focusing on interventions for economic growth, and that is done by the asset cluster. There is a comprehensive plan, and part of that is in a bigger document, which talk on the plans to revive and stimulate economic growth. The 6-month, which is medium term, is focusing on ascertaining the fallout, and there is a rapid evaluation that is going on. stimulating industries, various industries, mobilize financial relief effort, as I've indicated, and rebuild and sustain interventions even beyond the lockdown. In terms of our short plan, the short-term intervention of 3 months, we are focusing on sustaining quality of life, ensure social protection and relief, support, protect citizens, and be around supporting people and be people-centered government. Reduce expenditure and fiscal discipline be maintained. In terms of the education response, we are focusing on the following: preparations of school system with the department and the staff to return to work in a phased approach, starting with head office, the district, principals and teachers, and non-teaching personnel, as outlined by the department. Infrastructure, we're focusing on repairing of doors, windows, furniture that have been vandalized, and we're working through EPWP also to clean schools. Procurement of PPEs is on, with the aim of ensuring that all teachers and staff, when they get back to school, they get PPEs as well as learners. COVID-19 awareness and orientation, establishment of head office, health, and all levels. We will have COVID-19 safety committees in all levels in the province, going to districts and going to circuits. And there is a development and distribution of COVID-19 awareness material and guidelines, specific guidelines for the education sectors to educate the staff, learners, transport, and those who are working on provision of nutrition. So all areas are covered. Learner transport, we are going to be ensuring compliance, one on social distancing, sanitization, and we will ensure that the two departments are working together, the Department of Education as well as the Department of Transport, to handle that aspect. In schools, screening and testing will start as the staff comes back. We will have learners, staff, support officials going through the screening process, and then the hygienic protocols, and will be carried on daily basis. School nutrition, appointment of all service providers to commence with specific dates as given. Orientation of all of them will be done, and all of those interventions, including chief food handlers and food volunteer handlers, will be appointed in line with protocols as they've been issued. Identification of teaching vacant posts, we are working on that to support teachers who are unable to return to school due to various reasons that are related to health. Teaching and learning, as well as support of struggling and progressed learners, is also going to be attended. There is a program focusing at district level and each and every school. COVID-19 related psycho support, the psychological support will be offered, especially targeting child-headed families. Communication, we're working to prepare the strategy on the communication for opening of schools. Obviously, there are financial implications, and we will raise this as a major challenge. President announced all interventions, and he announced the relief that will be there, but there is nothing that was raised for the education sector. There is no amount dedicated for the sector which will help them, because when they go back to school, they need more desks now, they need prefabs, they will need additional staff. They now need things that they didn't need before, such as masks, sanitizers, and all of that. And I'm sure that our intervention as a whole, as government, focused on food relief, stimulating the economy, but we forgot the education department. And there was nothing that the department got. As of now, we're starting from zero plan, because zero budget in that regard, because there was nothing that was allocated. And I think that's one area that will request the president to assist us in addressing as we go forward. There are lessons that we've learned. Firstly, is that the first lesson is the coordination and integration of all departments. Though in any government and with us as well, you will still have individualistic approach, which is not helping in most cases. But I think the manner in which we have responded, we have been responding through clusters and as government. And planning together, the integration and coordination was enhanced during this era and will need to be sustained going forward. But more than so, planning and working with spheres of government, with the SALCA is part of us, and Amakosi, the traditional leaders. So this period have left a lesson that if we are more coordinated and working together, we make quick and serious impact. I think we have also improved in terms of ICT and fast resolutions and decision making. We are a bit improving on saving resources, and I think those are things that we need to learn. Working online is becoming a norm for many of us, even those who are not so much keen in using ICT. There is a strong coordination also at the district level, and the anchor has been the Operation Sukuma Sake. The information that has been generated during this time, such as informal traders, spaza shops, and vulnerable people, one lesson is that we didn't have enough information about some of activities that are taking place, and during this era, we managed to consolidate that. Better and improved communication to the citizens, I think it's one lesson. Challenges. The first and the major challenge, number of national departments have failed on the coordination that we are indicating. Number of departments will just plan on their own, and in their communication, they will not, in their implementation, they will not involve their respective departments here. There are a number of programs of public works that you will hear being implemented in the province with no one of us knowing that this is the program happening. And there are a number of programs coming from various departments nationally that will just go down to districts without us. And I think the Department of Human Settlement, Water and Sanitation, also at some point we found things going to districts without the knowledge of the respective provincial departments that must work as a conduit of that. In some cases, we are not saying implement through us. Even just to notify and coordinate together, it's important. And we do have specifics. I've mentioned 2 departments because that is so. But there are a number, there's still a lack of that integration when it comes from national going down. A second challenge, the national response has not been integrated into what we launch as the district development model. There is no minister attached to us up to this far. So that coordination that you will expect from national province going down is not yet there. The non-allocation of disaster fund for the education in particular is a main challenge. Poor connectivity and network for government and community centers has been also one of the main challenges. And given the geographical spread and location of some of these facilities, the issue of communication is one of the challenges. The non-homogeneous nature of diseases require the province to have responses that are targeted. The rate in which infections will be happening in eThekwini and Ilembe will differ with what you will see in Herigwala. In Umkhanyakude, the infection also only came with the tourists. And we just quarantined the 21 tourists who were there, and after that, there have been no new cases. So the manner in which we will need to have targeted approach also, it's one of a challenge that we've had. So the blanket approach will not be applicable. Fast-tracking the leakage, the link between the provincial and the national nerve center, especially with regard to accessing the dashboards, not on everything, just on the provincial information. That is one thing that is needed, we need to improve on. Way forward, we would like to draw lessons, take all of these lessons into our recovery plan. The recovery on the COVID-19 is dependent on the capable, ethical, and developmental state. Developmental state, a state that builds the capacity of the people to live on their own, support all individuals to live and sustain their livelihood. So we must begin to, while building on this welfare approach, but the developmental aspect that individuals must not be so much dependent. Going forward, it's a lesson that we must draw. Building a developmental state includes ensuring that citizens are capacitated to sustain their livelihood. The 3 clusters are finalizing the recovery plan. The GC have finalized the recovery plan, so the 3 others are still finalizing. The national COVID-19 single view system that has been developed has to be linked with the provinces and the districts. The national department that are implementing that are implementing programs in provinces need to ensure that they embrace an integrated approach of planning and implementation. But that must not only involve provinces, it must cascade to districts, and we must work in line with the DDM model. The national departments need to enhance the integration as we work on a recovery plan. So the plan of the national government must also entail what will be the submissions from provinces. We must fast track the tracing of increased connectivity in dealing especially with areas that are affected by the economy, the economic decline. So, President, that is our comprehensive report. It is just a summary. The detail is here in this report, which is very detailed, and so it is 70 slides. So from 70 slides, we just said, let us summarize it to 25 slides, which will capture what we would like to express. And this is our submission with the hope that we will continue to get the support. We will equally also, while getting support, being given leadership. As I conclude, let me take this opportunity to thank also the national government for the leadership that has been provided in dealing with this issue, the issue of this pandemic. And I think from the president to ministers, we have learned a lot. There are observations that we may want to share in future, but for now, I think we applaud the leadership that has been provided by the president and the cabinet as a whole. That is the end of our report. I'm not sure whether there are any comments, but we've developed the report together, colleagues. So no comments. No, thanks. Thank you. We will take the report. We will now move on to the Minister of Health, who will give us the remarks and then introduce the President. Minister Zweli Mkhize, Dr. Zweli Mkhize, will take us through.
Thank you very much, Premier. Mr. President, thanks for coming to KwaZulu-Natal and to receive the briefing that has come from the Premier. As we have reported before, KwaZulu-Natal was the third highest number, recorded third highest numbers of people who are testing positive. We have worked very closely together over a period. At the moment, I think the province has done quite well, containing a number of cluster outbreaks in hospitals. And so we are very pleased to receive the report that the Premier has indicated. We're working fairly closely together, and I'm also pleased that today they will be taking us through the inspection of the field beds. And President, those are the areas that President has been very keen to have a sight of, and so we're really looking forward to that. Colleagues, Premier and MECs, we all know the President has been leading this campaign on COVID-19, not only in South Africa, but also in the continent as the chairperson of the African Union. We therefore are very pleased and strengthened by the visit today, and having given the briefing which the Premier has given, I'm sure the President will be able to give us more guidance. I think our main issue as we're watching now, President, is to look at what the impact is likely to be for the change in the stage of the level of alert. The numbers of people who are moving around, we believe that it's going to start showing numbers increasing a bit more. So the question really is that we'd never thought that we'd be able to completely get rid of the viral outbreak, but that somewhere along the line, what we intend to do is to keep pushing the curve further. I'm very pleased the President has been given the briefing by the head of the Ministerial Advisory Committee. So at this point, colleagues, I think we need to give the opportunity for President to reflect and give us a guidance in terms of what advice we should be taking into account as we continue to fight this infection. So, President, we're all in your hands, and thank you very much for making the time to come to KwaZulu-Natal. Thank you very much.
Thank you, Minister Dr. Zweli Mkhize, and thank you to our Premier Sihle Zikalala. And let me take the opportunity to extend my greetings to the MECs who are here with us, the councillors who are also here, who also double up as mayors, and with one mayor of eThekwini who is just as dark as I am. Even as they say you are wearing a mask that makes you more dark. Ungawarufana nami wena. let me also extend my greetings to the officials who are also here with us, DGs and other officials, and members of SALGA as well, or leaders of SALGA. I really truly welcome this opportunity to be in your presence here in KwaZulu-Natal. I did long to come here, even way before COVID-19 hit us, to have an opportunity to interact with the Provincial Executive Council. But we are now here with COVID-19 having descended on us. I did want to sit down to hear exactly how our government is functioning. And in the course of your input, you have given me a lot more than what I had bargained for. Let me also start off by applauding the work that is being done in the province in relation to how you have gone about addressing the challenge that our country is facing in relation to COVID-19. You have demonstrated once again that faced with a major challenge and crisis like this, you are able to do much more than what one would have expected. You have set up the correct and right structures that are enabling you and us to properly address the situation that we are in now. I'm most impressed with the way you have gone about setting up the Provincial Command Council, which is underpinned by the work of the Provincial Command Center, the Provincial JOC, but you have even gone beyond that and descended down to the districts. And in doing so, you've utilized the structure that you have perfected very well, the Operation Sugumasake. And you have embedded the work that has to be done in addressing COVID-19 into and around the district development model, basing it on the good foundations that you built with Operation Sugumasake. And this is when we see the district development model coming to life, much as you bemoan the fact that, and correctly so, that our national response has not really anchored itself around the district development model. It's something that I've been concerned about, but you have just sharpened it a lot more, and we need to pay attention to it at the National Coronavirus Command Council. I applaud you for the way you have also utilized the MEC champions, including yourself, in giving leadership at the district level to our response. So in many ways, KwaZulu-Natal has once again demonstrated that it can distinguish itself extremely well at the national level and from other provinces when it comes to challenges like this. And also having the ability to identify the key concerns. Now, colleagues, we are in the midst of dealing with COVID-19, and much of the work that we are doing, which in many ways is led by Minister Zweli Mkhize, who has been doing a truly outstanding and sterling job for the whole nation in giving guidance and leadership and just intellectual capability and scientific as well on guiding our country in dealing with COVID-19. The very good plaudits and the good reflections and words of praise that are even coming towards us from international bodies are due to the work that he has been leading. When the World Health Organization looks at South Africa, I'm not saying this because, I'm South African and president and all that, but when they look at us, they see a truly shining example of how countries should have responded to the challenge of COVID-19. We are by no means out of the woods. We are not out of the woods. We are still deep in the woods. But the way Dr. Mkhize has led us, and also the important thing is that we've relied on science. We have not been flying with the seat of our pants and just thumb-sucking everything. The fact that he enlisted top-class scientists and doctors, as we saw led by Professor Karim, has positioned us extremely well globally, because we have not just been confused and sending out confused messages. We've been very, very direct and scientific in the approach that we've embarked upon. So at that level, we've done very well, and even at just the provisions we've put in place with regard to managing the whole state of disaster, as led by Dr. Dlamini Zuma, has also positioned us very well. So at that level, colleagues, from a scientific point of view, from a health management point of view, as well as from just leading the whole process of the various levels that we've now identified. And what you are doing here at the provincial level and also at the district level has really positioned our country, and the work that you are also doing here in KZN extremely well. But for me, that immediately raises an important lesson, that the way we have responded to this challenge is the way we must now respond to the next challenge that we are going to face. The next challenge is the economic one. COVID-19 has brought about a total destruction of our economy. Our economy, as we speak now, is under a great deal of stress and challenge. We now collectively must respond to how we're going to rebuild that economy, reposition that economy. And I am rather pleased that you have outlined the responses, and I'll deal with some of them, but you've also started to look forward of how we should address the economic challenges that we are facing. On your responses to the COVID challenge, from a health point of view, the preparedness, I must commend you in going about setting up the various centers that are going to have to be utilized as we address the whole challenge, setting up centers where our people will need to be treated, which you are now going to take me to go and see. The level of preparedness is quite impressive, because you've identified various places where people will need to be placed either for isolation, for quarantine, for treatment as well. The ICU centers that are also being set up. The beds that are now getting ready to receive the people who will inevitably have to be treated is something that is commendable. And I want you to increase the number of the beds. These are good numbers of beds that you have identified, some of which I will see, the ICU centers. But I'd like to see more of these because KZN is very highly populated, and Professor Karim and his colleagues who are dealing with this disease from a scientific point of view inform us that as South Africans, we must expect that the rate of infections is going to increase. They also inform us that we've done extremely well in leveling that curve. The lockdown, which was level 5, has done a great deal of good to our country, to our people, because whilst the spate of infections was supposed to go up exponentially, with the lockdown we have leveled it off, and in that regard we were able to ensure that there is social distancing, the chances of infections are lessened, and that has served us well. And in a way, it was getting us prepared for the spate of infections that are going to continue rising. And we utilize this time of level 5 lockdown to get ready. And I'm pleased to see that here in KZN, you've done a great deal to prepare for the challenge that we are going to see going forward. But I'd like to see more. I'd like to see more beds, and that I know is within your planning. And of course, the money that we have allocated at national level will also go a long way in helping you get more prepared and get more beds in this regard. Because we've got to plan, and I'm afraid we've got to plan for the worst. We are informed that the worst is still coming. We are going to get more people infected. But the important thing is that we need to ensure that we lessen the pace through which these infections are going to take place. And we'll be able to do that, one, by getting ready with all these facilities, two, by ensuring that there continues to be social distancing, people continue to wash their hands on a continuous basis, because we're informed that it is through our actions as individuals that we spread the virus, and also by wearing masks, as we now do, all of us, particularly when we are in public places like we are now. And also limiting the numbers of people, and the wonderful seating arrangement that is here enhances that social distancing that Dr. Mkhize and Professor Karim are urging us to do, and make sure that we are not an exponential number in meeting places like this, and certainly not more than the 50 that we want. I want to also commend you by addressing the other challenge that COVID-19 has presented us with, the distress amongst our people who, through the lockdown, have had to stop work, have had to stop their normal economic activity. At national level, we responded to this. This was a necessary intervention that needed to be made, and you have been handling it extremely well at the provincial level, and utilizing the pillars and the structures that you've got of Operation Sugumasake. You've been able to address the issue of households that are in distress and families that are in distress, up to and including on issues such as the distribution of food, and doing it in a very organized way, without getting our people to lose their dignity and to lose their humanity. And I'd like to thank you for that as well. Also in setting up shelters, and I know that the issue of shelters has been a very challenging one, not only for you here in KZN, but nationally, because those people who are homeless have become accustomed to a particular way of going about leading their very difficult lives. And when we put them in shelters, it is like we are, locking them up, and that's why they want to go on with their daily lives. But I'd like to commend your efforts in addressing the challenges that they face. And I guess in the end, some of them will stay in those shelters because they provide a place of refuge. On water, which is a major challenge for you here in KZN, and this is known, you have also gone about beginning to address the issues at short-term level, but there is a medium term, but in my book there is a long term. We do need, on a long-term basis, to address the issue of water in KZN. And this COVID-19 moment has given us the way and the wherewithal to be able to do a lot more than what we have done in the past. The capabilities that we've built up, as well as the resources, now needs to be spread around so that we reticulate more water points for our people, and make sure that we embark on long-term projects to address water sources, for instance, in Lower Umkomaas and in a number of other areas where there are water challenges. And some of those I have seen for myself in Ugu, Ilembe, Mkanyagude, and in Zululand. I have seen some of those, and I guess we've now, through COVID-19, put this challenge firmly on the map and on the radar screen. And going forward in addressing how we rebuild our economy and how we provide services to our people, this is what we will need to address. You highlight very well something that is very important in my mind, the issue of hygiene. We identified hygiene as a key area that we need to address. I guess with the lockdown, we were not able to wrap our hands properly around it, but the time as we move down to the other levels of the lockdown has now arrived for us to clean up our country. We now need to embark on a massive, massive campaign countrywide to clean up South Africa, to deal with issues like waste dumps that are in wrong places, and hygiene, and clean up the streets of our country and the rural areas as well. So beyond the various levels, the time will now have arrived for us to clean up our areas, even high-density areas or congested townships. There is just no reason why our people should continue living in squalor, in unhygienic places. As we deal with the issue of COVID-19, making sure that we deal with the sewage, with the sanitation issues. We need to disinfect public areas, but also clean up our country. And we will want to embark on massive campaigns to clean up where people congregate, be it taxi ranks, be it bus ranks, and many other places. So this will give us the opportunity to be able to do so. And of course, sanitation is a major challenge that we need to address. And I want to thank you for highlighting this in the way that you have, as well as highlighting another area of great, where we should have great focus, which is the creative industry and the cultural industry. These are areas that we need to focus on going forward, even sports and recreation. Your presentation spends a lot of time focusing on the economic response, and I'd like to applaud you for that, because through this you are having a futuristic approach to dealing with the challenges that our country is going to face. As I was saying, COVID-19 has dealt a huge blow to our economy, and we now need to address that economy, because the economy sustains life, and our lives as South Africans revolves around economic activity. We need to be focusing on that. You will have noticed that the relief package that we announced focused also largely on the economic side, as it did on the social side, but also as it did on addressing the challenges that workers are also going to have or are having at this point in time. I want to thank you for spending quite a lot of time and focus on the economic side, because COVID-19, quite frankly, is giving us an opportunity to relook at our economic side of life, to see how do we as South Africans reconstruct our economy after coronavirus, knowing that coronavirus has dealt a huge blow to our economy. I'm characterizing the coronavirus after effect as being like a war, a post-war situation. We've been fighting an invisible enemy, and now we must start planning for a post-war situation, which gives rise to a number of challenges as well as opportunities. And we must also address those challenges that COVID-19 is going to yield at the economic side. And my view is that we've got to begin to put in place the pillars of a new economy. We cannot continue in the same old way. New economy where we are now going to identify possibly new sectors of our economy going forward, rebuilding those that have been badly affected by COVID-19, but also finding new sectors that we now need to put in place. Many people are going to lose their jobs. We need to find and create and build jobs for the many of our people who are going to lose jobs. We need to be asking ourselves, what is this new vision that we envisage for our country going forward? We need to come up with a clear economic strategy And the building blocks are already in place. We now need to put them all together. The important principles is that it must be an economic future that is going to ensure that the growth that we will have is inclusive. It must also be empowering to women, to young people, and to black people in the main. Radical economic transformation must underpin the economic future that we will need to craft going forward. But we should be able to do this through a new compact that we are going to build. A new compact amongst all key role players in our economy, in our country, labor, business, community-based organizations, and government. We must be able and visionary enough to set up this compact to be able to ensure that as we rebuild the economy of our country, we look out for new sectors of our economy, new ways of economic activity, new ways of management of our economy, be it at the corporations level themselves. They need to find new ways of functioning. Our state-owned enterprises must also function in a way that will be developmental, in a way that will be ethical, and in a way that will be innovative. In the course of all this, we also need to build state capacity and strengthen state capacity. And as you correctly say, we need a state that is going to be capable, ethical, and developmental. But I want to add that it must also be a state that is innovative. Innovation must underpin the many things that we are going to be able to do. We must be innovative. We must be willing, as we rebuild our economy and build new sectors of our economy, utilize technology. And we've seen how the ICT sector or digital capabilities have enabled us either to continue meeting, even as we are not meeting physically like this, to meet virtually, even globally, we've been able to do so. We should utilize technology, and we've got technologically capable people in our country. We need to harness them and make sure that all of us work in a way that will enhance the growth that we want to see. The important thing that we are going to have as a clear vision is that we're now going to have to go for growth in a big and exponential way, and be willing and be brave enough and courageous enough to massify whatever needs to be done. Because playing around on the edges of efforts that we are making, that time is over now. We are going to be facing a huge problem of unemployment. We now need to massify whatever we do. And in a way, COVID-19 gives us an opportunity for a new beginning that is going to make us have a new way of doing things, new sectors of our economy, new ways of functioning. And it should enhance a number of things that we need to do as a country going forward. Now, in KZN, you've always come forward with new ideas, and embedded in your document here, I see a number of new ideas that can be picked up to be utilized for the nation going forward. You bemoan the fact that there is no allocation for education. You're absolutely right. We did not single out education because education is going to be facing massive challenges going forward. Some of our schools have been destroyed, and we therefore are going to need resources. Just as we have given resources to health, this is another area clearly that we need to focus on, and we will focus on it, and we will find those resources. You bemoan the fact, and correctly so, that a number of national departments have not been coordinating very well what they are doing with the province and in some cases with districts. That is something that will be addressed immediately so that we improve on it. You raise important points that have to do with challenges that we will be addressing. I want to thank you for plotting issues that you believe should be the way forward for us and the lessons that we have learned and how we should go about coming up with recovery plans for the challenges that we have. I think you've identified a number of key areas that we need to be focusing on. And the issues about lack of coordination with the national departments, I will make sure that we address immediately, as quickly as tomorrow when the National Coronavirus Command Council meets, so that there is that active and focused interlinkage between national departments, the province, as well as the districts, and going further down to the local government at the municipality level. So I'd like to thank you, Premier and colleagues, for all the great attention that you are paying to all this. For me, the important part is that you are paying very focused attention to the challenge at hand, and coming to KZN always lifts my spirit, because I know that you are quite focused and serious in dealing with issues of a provincial nature, but which also impact at the national level. So thank you very much for all the reports that you have tabled, and it's a very good report, a 70-slide report, which you have summarized in 25. But even the summary is just as good as the full 70-page slide report. And I want to thank you for all the dedication and the hard work that you've been putting in. I've been watching nearly all of you crisscrossing the length and the breadth of the province, and I've been wondering, when do you sleep? Because it looks like you never rest. You're all over the show, and you're dealing with problems and challenges that our people are facing. And I'd like to thank you for the dedication and the commitment that you continue to show for the people of KwaZulu-Natal. So I will be telling them that you are indeed the servants of the people, and thank you very much for the work that you do. Thank you.
Thanks, Your Excellency, the President. Colleagues, thanks also to the Minister. Colleagues, that take us to the end of this first session. We are going to have a brief interaction just for 20 minutes, and after that leave straight to Dr. Pilsika Isakaseme Memorial Hospital, at Bridge City. Not all of us will be there, but we've agreed on who will be there, and others will be in other points as we have agreed in the planning of this session. Let's thank all of you and colleagues. Let us then adjourn. But before we adjourn, let's take this opportunity to request that we observe a moment of silence. Firstly, in respect and in honor of many people who have passed on due to this